It's a trend that we don't like to see, how St. Louis is starting to look a lot like Chicago when it comes to the coronavirus.
Play ball! Well, the MLB hopes so in 2020. They have a plan to make sure that happens if the ball rolls in their favor. I'll tell you what needs to go down in order for that to happen.
We've got warm temperatures. We're already at 71 degrees with a lot of clouds around today. We'll let you know how warm it'll be and what the rest of the week holds.
You're watching Today in St. Louis.
Good Tuesday morning, everybody. I'm Rennie Knott. And as we practice social distancing, our Allie Corey joins us from her home in Wester Groves. Good morning, Allie.
Hi, Rennie. Good morning, and good morning to everybody at home on what is going to be a beautiful day to get outside and soak up some of that sunshine. But first, you got to stick with us. We're going to get you updated on everything you need to know. Rennie, what is that question of the day?
We will start with the question of the day. We want to know, in the past month, how many times have you filled up your car with gasoline? Go to the 5 on Your Side app and weigh in. We'll have the results coming up later in this newscast. We have a lot to get to over the next 30 minutes. Here are the latest developments. We will take a look at Missouri's unemployment program, how local doctors are trying to control the spread of COVID-19 in North City and in North County, and the Redbirds could take the diamond as early as next month, the plan to bring back baseball.
Okay, Rennie, let's start with a look at the numbers in Missouri and in Illinois. In Missouri, 2,467 people have tested positive. 51 people have died. In the past 24 hours, there have been 144 new cases of COVID-19 in St. Louis County. Yesterday, St. Genevieve County reported its first coronavirus-related death. Over in Illinois, 12,262 people have tested positive. 307 people have lost their fight with COVID-19. Most of those cases are in Chicago. Looking at our area, only 218 people have tested positive. 5 people have died.
The fear of getting the coronavirus is just one of the stresses that we're facing right now. Finances like paying the bills and making the rent are weighing on us as well, especially as more people begin to lose their jobs. Our Savannah Louie joins us now with how the government is taking steps to bring some folks some ease. Good morning, Savannah.
Good morning, Rennie. This is definitely some good news for folks who have been unemployed. If you do qualify for unemployment, you will get a $600 check a week from the government, and that could start as early as next week. Now, this is all part of the CARES Act. We told you about this before on Today in St. Louis. It's the $2 trillion stimulus package. This aid comes as more than 100,000 unemployment claims were filed in Missouri for the last full week in March. That's up nearly 150% from the week before. That week in March was significant nationwide. You can see here, unemployment doubled. A record 6 million Americans filed for unemployment. It's the following week that affects those $600 payments. If you filed for unemployment on or after March 29th, you will receive those government payouts. You can get this money even if you do receive other unemployment benefits like military. The last payable week for those $600 will be the week that ends on July 25th. Now, we've just learned that today, County Executive Sam Page will address how the county will be handling some of those CARE Act funds. We'll bring you updates on air, online at KSDK.com, as well as our 5 on Your Side app.
Thank you, Savannah. Senator Roy Blunt has announced that Missouri will get an additional $3.9 million. The money will come from the CDC. It'll go to COVID response efforts, including buying medical equipment, improving testing, and helping hospitals stay fully staffed.
In Chicago, they announced that 70% of the people who have died from COVID-19 were African American, and that is a disparity that is starting to show up in St. Louis as well. When you take a look at a map that shows the cases by zip code in St. Louis and St. Louis County, the highest concentration of cases are in North City and North County. One doctor treating COVID-19 patients in the ICU at Christian Northeast Hospital says the overwhelming majority of her patients are people of color.
There is an inescapable risk for people in the North City and North County because of those deep historical norms that basically have created a scenario where life is not as supported.
Dr. Lori Punch says for people in those neighborhoods, access to food and transportation, even social distancing, isn't a given. To stop the virus, the doctor is calling for educational outreach, more screening, and a plan to assist daily life as the outbreak continues.
Today, the CEO of Center Point will respond to accusations after 15 staff members and 3 patients tested positive for COVID-19. The hospital stopped admissions yesterday and is expected to resume them today. The St. Charles Hospital treats psychiatric patients. They're now working with the St. Charles Health Department to notify people who may have been exposed. And the number of cases at the Frontier Health and Rehabilitation Center continues to grow. The St. Charles County Department of Public Health says 35 residents at the facility have tested positive. 3 have died. 7 staff members have also tested positive. Those employees are being quarantined at their homes.
Well, the CDC is now recommending that we all wear some sort of face covering when we go out into public. But do those DIY masks really protect us? Well, Dr. Michael Lim, he's an SSM health physician, says the one that our Tracy Henson is using is good because the loops go around the ears and you don't touch the mask itself. The same rule of thumb applies to the no-sew masks the CDC has tutorials for.
A couple, 2 or 3 layers within that mask, and there's enough layers of a nice cloth material that will protect from you aerosolizing a virus out to others.
Now, Dr. Lim says it is best to wear your mask not totally loose, but it should be pressed up against your nose and up against your cheeks. And just because you are wearing a mask, it doesn't mean that you can hang out with your friends again. You still need to practice social distancing. Rennie?
We're taking a live look now at Busch Stadium, where the Cardinals should be preparing for a game against the Dodgers. Everything is on hold, of course, now, but a new report overnight says baseball could start up as early as May. Our Ryan Henson reports on how the game would be played.
Well, the MLB is definitely swinging for the fences with this plan. The good news, the plan has a thumbs up from federal public health officials. The bad news, no games at Busch, and all games will be in Arizona in front of no fans. But they'll be on TV if the plan goes through. This is all good reporting by ESPN right here. Now, all games will be played in the greater Phoenix area, the biggest field being Chase Field. That's the Diamondbacks' home field, and 10 spring training facilities and other fields if needed. The teams will be sequestered in hotels and only travel to and from games. Once again, no fans. ESPN also reporting there's a few stumbling blocks that the league would have to hurdle. One, they would need the support of players, coaches, and personnel like employees to be isolated for around 5 months during the duration of the season. Safeguards would be needed to ensure the health of players, coaches, and also those personnel, some of which who can be generally older. An adequate amount of tests that have a quick turnaround are significant to the plan, but officials feel they can get their hands on those by next month. Now, being optimistic, they want to have this up and running by May, but some people are saying it's probably going to be a little bit closer to June when all of this will take place. And the game itself will change too. We've talked a lot about social distancing. Well, some tweaks will be made in the game to make sure players and personnel are separated so nobody's spreading any germs.
You know what, Allie, the idea of there being baseball in the month of May is incredible to hear. It'll be odd, but I think it'll also be very tough for the players to be sequestered from their families for so long. You're talking 4 to 5 months.
Yeah, and Rennie, the thing that kind of has me scratching my head over here is another 4 to 5 months. I was hoping that by that time we would be out of this thing. So why would they have to continue with a different type of season and all that isolation if we're out of the woods? That kind of is alarming to me.
Like Ryan was saying, a lot of questions remain to be answered right now. But at least there's a plan moving forward. We'll see if it all pans out. Thank you, Allie. Remember that the increase in numbers are going up day to day, but we'll put some perspective on all this. Coming up after the break, just how many people are battling COVID-19. And Boris Johnson was rushed to the ICU as he continues his battle with COVID-19. We'll update you on the condition of the Prime Minister up next. And the workouts don't stop for the